Hello everyone. Today is day 4174 of Lupus. It's been a bit since my last video, and I feel like things are, just as bad as they always like to be. In my last video, I had seen, a new pain management doctor, or I did a consult with a different pain management doctor to see if they'd be more aligned with what my goals are for pain management. That didn't work out. And at that time, my rheumatologist was saying he didn't know how else he could help me. So update, that's still the case. I'm still with my current pain management team. We've just sort of settled, or I've sort of just settled on muscle relaxers and like Lyrica and stuff. The only new thing that's kind of going on is my back pain is like it's unbearable at this point. Particularly my lower back, that I have caved in and agreed to do the process to potentially get in a spinal ablation to help with that little bit of arthritis that I have, and hopefully it opens up those nerve pathways and relieves some of my pain. In terms of my nerve issues, my legs have been randomly going like limp. If I lay the wrong way, or if my dog, who's only like 20 pounds, like lays across my lap or whatever, if he like sits on a certain spot or something, my legs will just like, they almost like lock up, and it feels like it's cramping, but then it's like tingling, and I physically cannot move the leg unless I like move it with my hand and like pick it up and put it in a different position so that it can like get the blood flow or something back to it. It's really weird. I don't know how to describe it otherwise, but that's kind of just where my legs have been at for maybe 2 months. My overall nerve pain is okay. But my major issue that I have had recently is this horrendous side in my pain that started March 12th. Today is April 6th. So it's been almost a month straight of this horrible pain in my side. And it's like, it kind of feels like a muscle pain, because when I push on my side, it's like I jump out of my skin. It hurts so bad. If I twist or move a certain way, it'll like catch me where I like freeze, and that hurts horrible. I went to the ER for it the other day because I'm like, I was told a week ago when I went to urgent care, again, I originally went for the side pain, that I had a UTI, and she thought the UTI spread to my kidney, and that's why I was having that side pain. And so I've been taking the antibiotics, and it wasn't working, so I went to the ER, like, hey, she said she thinks this was in my kidney, but these antibiotics aren't working, and the doctor there was like, I don't know why she told you that. I was reviewing, the results. I don't think you ever had a UTI in the first place. It's like, oh, great. So I was just taking antibiotic for funsies. So that's going to work out for me, I'm sure. That's not going to cause me any undue issues. But outside of that, they did a CT scan with contrast. Couldn't find a thing. His explanation was, well, then maybe it's a muscle of some sort that's irritated. So that's just kind of where I've been left with that. Um, his solution was, well, maybe I can give you like some muscle relaxers. I'm like, dude, I'm already on that. So this was essentially a waste of 8 hours. It was really bad last night. I really wanted to go back to the ER in the middle of the night because I feel like I have a really high pain tolerance because I'm in pain all the time. So if something is bad enough for me to want to genuinely go to the ER, there's an issue. But the CT scan didn't show any blood clots or nothing wrong with the kidney, nothing wrong with my spleen, which he had briefly mentioned was a potential possibility. And for those who don't know, I lacerated my spleen last January when I fell. So I was like, well, it shouldn't be my spleen. They told me that was healed a year ago, but with me at this point, I wouldn't even be surprised. But no, spleen's fine. Literally everything was totally normal outside of it showing I have a fatty liver, but that's not new. But bilirubin, which is indicative of liver damage, was in my urine. Not a UTI, but that was. And my urine has never showed that before. And my pee, I'm just gonna be honest, looks like tea. It's like this brown color, which, again, from researching, if you have a lot of bilirubin, it'll make your urine look like a tea-like color. So I do have a liver doctor. I'll probably give them a call tomorrow. It's Sunday. It's Easter Sunday right now. So, can't call anybody. But tomorrow I'll probably call them because it's literally the only abnormal thing that scan showed. And so it's all I have to go on. It doesn't make sense that would be the cause of my pain because my pain is on my left side only. And your liver is on your right. So if anything, that would cause pain in my right side. But I don't question anything anymore. And I'll take whatever little leads that I have. Outside of that, my platelets have dropped significantly. Like, we're in the danger zone now. It was holding at 40 for a few weeks, and if you don't know, your platelets should be between 2 to 300. That's the safe number. And for those who also don't know, your platelets are the cells that make your blood clot. So if you don't have enough platelets, if you get like cut or something or hit, you'll just bleed. Like if you get hit, you could have internal bleeding. It's like a whole thing. And this is like the third or fourth time now where I've had these sort of episodes. And my platelets the other day at the ER were 36. My hematologist, we originally had a plan for me to do an infusion to temporarily bring the platelets up while we came up with a more long-term solution. Her initial plan she wanted me to increase the steroids, which I didn't want to do because I'm already trying to get off the steroids. I've been trying to get off the steroids for over a year. I don't want to bring it back up again, and yeah, it'll fix the platelets, but then now I'm forced to stay on this high dose of steroids for a long period of time. That's not a long-term reasonable solution. So we're going to do the infusion, but in her opinion, the infusion is essentially along the same lines it's a temporary fix, and unless I'm constantly getting it over and over and over again, those numbers aren't gonna last. They suggested me switching my infusions, the Safnello that I get every month, which I did miss March, but that was on me because I realized way too late that I never scheduled March for some reason. Switch the Safnello back to Rituxan, which I was on a few years ago. And in my notes, because I write down everything, clearly I document my process of how things have been going for me. And I did not have a good time with Rituxan, so I kind of really don't want to risk switching the Safnello, which for the most part is doing pretty good with other parts of the body, like lab-wise, but just not the platelets, to, okay, we fixed the platelets, but then like all these other things are now messed up again. I don't really want to deal with that. So, yeah, she said that she didn't want to do the infusion, the IVIG infusion to fix the platelets unless I hit 20, which is, would be critical levels. And at that point, I'd have to go to the ER for that. So that's kind of where I'm at right now. Horrendous side pain with no idea what caused it. Platelets dropping every day. I have bruises all over just from existing. They're just there. I really want to go back to the ER for my pain. Oh, and yesterday my armpits hurt really bad. I do think that they're ingrown hairs because I shaved recently, but they hurt in a way that doesn't make sense for ingrown pain because it's like the whole armpit is swollen. So that's fun, and it's on both sides. That's a new fun, interesting turn of events that I got going on. I've kind of just been feeling defeated, like the lupus is just here to stay and I just gotta suffer through this until I die. The only other thing that I've been trying to come up with is some new drug or alternative that I could try, because clearly the stuff that's currently available is I'm too powerful. It's not gonna work for me. So in my research, I found this thing called CAR T-cell therapy, which those who have cancer, it's not new in their community. So what it is your immune system produces something called T cells. So what this is it takes the T cells out of your blood, it separates it and everything, and they attach antigens, specific antigens that attack B cells. Google it, it's a whole thing. I'm not gonna explain it correctly. And they infuse that back into your body so that now these T cells now have these antigen tracker things for the B cells, and it goes and it finds them and it kills them. Essentially, it's a reset on your immune system. Like, it completely kills your immune system, resets it to zero. You do not have an immune system. And then from that state, your body will hopefully, fingers crossed, heal to turn around and be normal, essentially. I mentioned this to my rheumatologist at one of my last visits, and he said he had heard of it. It's not FDA approved right now. They're still doing trials and things like that. His concern is, from what he had heard, it's a 75% mortality rate. So he didn't really want me to risk it, but I couldn't find those numbers anywhere. I spoke to my hematologist, who also happens to be an oncologist, someone who works with cancer patients, and she said she hasn't heard of those numbers, but she said I only know of, reports in regards to cancer patients. I don't know if numbers and things are different for use in autoimmune diseases, which is fair enough. My take on it, my family doesn't like the idea that if it truly is a 75% mortality rate, they don't want me to do it. But my take on things at this point in my life is, if it works, great, I have a cure. Love it. If it kills me, I don't have to deal with any of this anymore. So I'm not really seeing a downside. And that's kind of where I'm at. I reached out to, there's 2 studies listed in Arizona that I could find on like the clinical trials government website. And I reached out to both of them, and I've heard back from one who said that there's not currently a spot just yet, but there's a new trial coming up soon and they'll keep me in mind, yada yada. The other people, I don't think, ever answered me. I gotta double check that. But essentially, there's nothing happening with that right now, so I don't know what the plan is moving forward. I'm having a consult with a different rheumatology team on later this week, and hopefully they have some good ideas that my current rheumatologist, would agree with. Otherwise, I'm back to square zero. So yeah, that's my update. I know it's been a few months since I've seen you guys. I can't remember if the last video that I did was before or after December, but I did have COVID in December, and this was the first time that I didn't have taste or smell, and I was not a fan of that, and I did become quite a bit short of breath. After that, I've had another pulmonary function test. I've had my annual echo. Literally all of the numbers are exactly the same as they've been. So that's good, at least. That's not changing. It's really just this pain, and then like the nerve situation. My migraines are also coming back. That's been a little fun addition to my day every day, waking up to a migraine every single day. Haven't had that in years. Luckily, I got approved for Nurtec, so that's been helpful. Life is crazy. If any of you guys have lupus, please sound off below. Do you deal with any of this craziness? Because I'm over it. I'm over it. All right, guys. I'll see you in the next video.